I want to thank you for joining me for the National Day of Mourning on Monday, and we continue to pray for those who have lost loved ones to this virus. Before the murder of George Floyd, and before the country heard yet again the cries for racial equity and justice, we already knew that COVID-19 was disproportionately impacting communities of color. In North Carolina, African Americans make up approximately 22% of the population, but as of June 1st, they account for 30% of the confirmed COVID-19 cases and 34% of COVID-19 deaths. Latinx people are just 10% of the population, yet they make up 39% of COVID-19 confirmed cases. These statistics are alarming, and they are not acceptable. I want to be clear that there is nothing inherent to black or brown people that makes them more susceptible to severe COVID-19 illness. The data should not be used to further racism or fear. The disparities because people of color have historically had less access to health care, housing, economic opportunity, and more. This virus is exploiting those inequalities, and it's up to us to do something about it. So today, I'm proud to have signed Executive Order 143 to address disparities in communities of color that are being highlighted and intensified by this pandemic. This order moves our state forward in several areas. First, it creates the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force to address these long-term disparities. My friend Andrea Harris dedicated her life to eliminating disparities in North Carolina. She fought for social, economic, and racial equity. We lost Andrea a few weeks ago, and our state will miss her advocacy and her action. Naming this task force in her honor is a way to carry on her mission. The task force will focus on 5 areas: access to health care, patient engagement in healthcare settings, economic opportunities in business development and employment, environmental justice and inclusion, and education. Our Department of Administration Secretary, Michelle Sanders, will lead the group. Secretary Sanders is a strong leader, an accomplished businesswoman, and a fierce advocate for all of North Carolina. I'm excited she's going to take this on, and we'll hear from her in just a minute. In the coming weeks, we'll name a diverse panel of experts from each of the 5 focus areas, as well as community and state agency leaders to serve on this task force. As the task force examines long-term opportunities, there's some meaningful things we can do right now to lessen disparities. We know that black and minority-owned businesses are often overlooked and under-resourced. Too many of these businesses have been excluded from COVID-19 funds. My order directs the North Carolina Pandemic Recovery Office to ensure that COVID-19 relief funds are fairly distributed. It also expands the capacity of our North Carolina historically underutilized business office to provide those businesses access to opportunities and resources. We know that minority and marginalized communities are more likely to suffer from chronic health conditions, including diabetes, kidney disease, obesity, and asthma. The data shows that these underlying health conditions significantly increase a person's risk for severe COVID-19 infection. In an effort to ensure that all communities have access to health care, my order directs the North Carolina Department of Health and Human Services, in partnership with community health centers, local health departments, rural health centers, and free and charitable clinics, to provide COVID-19 testing and related health care to uninsured North Carolina, people who are uninsured in our state. Now, ultimately, we know that the best thing we can do to improve health care for everyone in our state is to expand Medicaid. North Carolina should have done this years ago, and I'll keep fighting to close the health care coverage gap. Going to a doctor should not be a luxury, whether or not there's a pandemic. The order also provides direction for other state agencies. Now, I know that those marching and protesting right now are lifting up their voices for more than just health disparities. We hear you, and there's more to come. But today, we're taking steps to help reverse the impacts of long-standing inequality made worse by this pandemic. My administration is committed to helping to eliminate these disparities. We will keep listening. We will continue to work with communities all across our state to address systemic injustice. And now I'd like to ask our Secretary of Administration, Michelle Sanders, to share some remarks with us. Michelle?
Thank you, Governor, and thank you for your continued leadership during these unprecedented times and challenging times. While we have been laying the foundation for this new task force for some time, the work we officially began today with the announcement of Executive Order 143 couldn't be more timely. I am deeply honored for the opportunity to chair this new task force, the Andrea Harris Social, Environmental, and Health Equity Task Force, named in the honor of one of our great African-American civil rights, environmental, and social justice leaders, Mrs. Andrea Harris. As the governor said, she was a champion for racial and social equity and justice for all people, and worked tirelessly and fearlessly to eliminate health and economic disparities across this great state. I know that she will be with us in spirit, and I know that as we pick up the torch in her honor to grapple with these complex and critical issues for North Carolina, that together we will do well. I will chair this new task force with courage, inclusion, and hope for putting forward evidence-based and data-driven recommendations with tangible results. Addressing disparities in health and health care is important not only from an equity standpoint, but also for improving the health more broadly by achieving improvements in overall quality of care and population health. As a unified state, I know that we can get through these difficult times together. However, we also must acknowledge the systemic inequities that class, race, gender, and other social determinants present. We are not all faced with the same challenges and must look to provide alternative solutions to mitigate the impact of COVID-19 and other economic, health, and equity issues on vulnerable populations. The onslaught of COVID-19 and the resultant economic downturn has disproportionately hurt our communities of color, particularly our Black communities. You heard the governor mention that as June 1st, African Americans make up 22% of North Carolina's population, but account for 30% of confirmed COVID-19 and 34% of COVID-19 deaths in cases where race is known. And 90% of our historically underutilized businesses, which represent 58% of North Carolina's small business community, report that they have been impacted by COVID-19. The task force will work with various subject matter experts to identify best practices for creating economic stability, eliminating health disparities, and achieving environmental justice for communities of color. As mentioned by the governor, we will focus on issues relating to access to health care, patient engagement in healthcare settings, economic opportunities in business development and employment, environmental justice and inclusion, and education. We will focus on the root cause of these issues. The root cause of health inequity began with historical and contemporary inequities that have been shaped by institutional and societal structures, policies, and norms in the United States. These deeply rooted inequities have shaped inequitable experiences of the social, and other determinants of health, education, income and wealth, employment, health systems, services, housing, the physical environment, transportation, and the social environment and public safety. Health inequities are a result of more than individual choices or random occurrence. They are the result of ongoing interplay of inequitable structures, policies, and norms that shape the lives. These structures and policies and norms, such as segregation, redlining, and foreclosure, and implicit bias, play out on the terrain of social, economic, and environmental, as well as cultural determinants of health. I look forward to working and collaborating with state leaders and the Department of Health and Human Services, the Office of Environmental Quality, the Office of Minority Health and Health Disparities, the Pandemic Recovery Office, members of the Commission on Indian Affairs, the Commission on Inclusion, the Hispanic Latino Council, and the Council for Women Advisory Board, as well as partners and experts and stakeholders across the state of North Carolina in addressing these issues for more equitable and unified North Carolina for all people. And as President Obama said, change isn't easy, but it is always possible. And we are going to work to achieve that possibility for the state of North Carolina. Thank you.
Thank you, Secretary Sanders. Here today we also have Dr. Cardra Burns, the Senior Deputy Director of the Division of Public Health, to announce some new tools that we're engaging in our fight against COVID-19. Dr. Burns, we welcome you today.
Thank you, Governor and Secretary Sanders, for your leadership. In almost every health measure, communities of color fare worse. COVID-19 didn't create these disparities, but it made them acutely visible for all to see. The root causes are complex, interconnected, and rooted in structural racism, implicit bias, and historical inequities. This is no longer acceptable, and the question is, what will we do? I can proudly say a lot. Embedded in all of our COVID-19 response is the goal of achieving health equity by investing in and directing a disproportionate amount of resources to historically marginalized populations. One way we are doing that is beginning with ensuring that we break down barriers to access for testing. The new initiatives that I'm announcing today are a part of a larger effort to make sure that COVID-19 testing is available in trusted and accessible places for communities of color. Today, we are launching 2 new online tools to help people determine if they may need to be tested and find a nearby testing place. Many people may feel uncertain or confused about whether they should get tested. While there is no substitute for a conversation with a medical professional, our new online tool called Check My Symptoms allows people to enter their symptoms to determine if they should get tested for COVID-19. Find My Testing Place is a resource for anyone who needs to be tested for COVID-19 but aren't sure where to go. People can enter their county or zip code to find a testing site. These new online tools and resources will help North Carolinians have the information and support they need to protect themselves and their loved ones. Before I conclude, I can't talk about testing without acknowledging my co-lead, Dr. Scott Schoen, the Test Surge Work Group, and noting that today we reported our highest number of tests completed at more than 19,000. I am so appreciative of our local health departments, federally qualified health centers, hospitals, health systems, private providers, commercial labs, community partners, and so many others who are ensuring that testing is widely available and who are intentionally focusing on our communities of color who are disproportionately impacted by COVID-19. And of course, everyone should practice the 3 W's when they leave home. Wear a face covering, wait 6 feet apart, and wash your hands often. Success depends on all of us working together to protect ourselves, our loved ones, and our neighbors. Thank you.
Thank you, Dr. Burns, and thank you, Dr. Schoen, too, and the Test Surge Work Group. Having reported more than 18,000 tests conducted in one day is pretty impressive, so I appreciate that. This is an important effort to boost our testing and tracing, and these are critical pieces as we fight this virus. I also want to briefly mention and thank our dedicated men and women operating our 211 resource assistance phone line. They've marked 50,000 calls processed since the start of this pandemic, helping people get connected with community and social service resources. We applaud your efforts, and we are really grateful for them.